Dr. Robert Lim.
I'm honored to be part of this prestigious company. It's a wonderful experience for me working with NutriWell International for the past several months. I'm proud to announce that we have one of the finest as well as the safest product in the market today. It's very timely that Olea was formulated because so many unhealthy modern lifestyle we have. We're bombarded with pro-inflammatory processes daily, and the available anti-inflammatory products in the market have serious adverse side effects. It's a good thing that there's an available natural, safe, and effective alternative product to replace these toxic non-steroidal anti-inflammatory drugs that will address the inflammation and pain in our body, as well as to prevent chronic degenerative diseases from developing. It's none other than Olea capsule and topical oil. Based on my clinical experience, it is very effective for alleviating the pain in arthritic patient, whether it is chronic or acute, as well as for those who have work-related or sport-related injuries. A remarkable case I have is with an elderly female who has a breast tumor in her 12 o'clock nipple, as well as an axilla. No? After taking Olea capsule, as well as applying Olea topical oil for 2 months, it shrunk. No? This one disappears, and this one is already shrunk to a very minimum size. So I therefore conclude that Olea is really a very, very effective and safe alternative for your NSAID, as well as preventing and curing and treating chronic degenerative diseases like tumors and cancer. Thank you very much. So to have a pain-free, healthy life, to have wellness, choose NutriWell, choose Olea. Thank you.
Doctora Mirna Cuerdo.
So, I'm going to share with you how I came over here at NutriWell. It's because of my mother who has a degenerative disease, the rheumatoid arthritis. So it has been my advocacy to find an anti-inflammatory drug without a side effect of it. So when I attended a seminar in naturopathy, I came across Olea. Then I thought this is the medicine I have to give to my mother to prevent the side effect of NSAIDs, as what Dr. Lim has told us a while ago. So when I let my mother take it, it was very good to her. So sabi ko, ano kaya meron dito sa Olea capsule na soft gel na to na mabilis ang effect? So pumunta ako sa Mega Trade Hall noon, then in-inquire ko. So ito palang Olea na to ay merong omega oils, which was taught to us in medicine na essential sa body, which is very good, as what Dr. Lim again told us a while ago. So sabi ko, kung ito natural, ito ang kailangan ko. So may advocacy na maghanap ng ganitong klaseng gamot, nakuha ko na. So inano ko na to sa mga patients ko. And I find the product very good for them. So I hope all of you who are here, ma-experience nyo rin yan. And I think you have. You have all the testimonies in each one of you na magaling talaga itong Olea. So, power, di ba, ang Olea na product na to. So, maswerte tayo ngayon na na-formulate ni Angie Masilang ito. It has been given to us through a divine intervention. So, I hope we continue to prosper and Angie can develop more products for the entire Filipino people. Thank you.
Dr. Cynthia Santiago.
My experience with this natural oil, being a senior citizen, I sometimes experience low back pain. And I'm happy to share with you that when I use this Olea oil, I experience immediate relief. And just the other night, when I experienced this relief, I gave 1 bottle each to my family members. And the other night, my daughter was having dysmenorrhea. I told her to put a little oil on her hypogastric area, and she said that she already did. Unfortunately, the oil did not work instantly as it did in my case. But after maybe 15 to 20 minutes, the dysmenorrhea disappeared. I'm still trying the Olea oil on my uncle who has a hernia, but because I said I just used it recently, I still have no effect to relate to you. But being a member now, and since I believe in this effectivity, I will share it with you later. Thank you very much.
Dr. Rhoda Asado.
Good morning, everyone. Well, I'm also a new member in this, our group. I will also share 2 cases of mine. One is my daughter, a 36-year-old. She's been having migraine for the last 10 years. So that time, I brought the product with me, and then I told her, you try the capsule at the same time, the oil. So last week, she just texted me that the migraine just gone, okay? So, in spite of that, she only took 1 capsule a day. And then the duration was like a month of treatment. So I told her to continue this capsule of 650 milligrams once a day. And then the other case is one in the veterans, one of our patients, 60-year-old female. She was been complaining of this lump, a mass right on this chest. Not a rubbery consistency. I could not also consider a lipoma, but I also tried to let her take the capsule and the oil. So at least the capsule the same, to take her 650 milligrams, 1 capsule a day. So a month later, for a follow-up, me myself witnessed a change in that swelling. It just spread, no? The flattened, the swellings flattened. So I don't think, I hope we will see next month na it would really begin everything. So I let them take maintenance medications at least for a longer period for follow-up. Thank you.
Dr. Marie Francine Castiglione.
Our products is very, very good for every one of us, especially for me and for my patients. So anyway, this is my, why I got Olea from, when was that, Miss Eva? I think that was 4 months ago, more than 4 months ago, 5 months ago. Okay, when it was introduced to me, the first time when I was at St. Luke's, somebody came to my clinic and said, Doctora, I have something for your patients, since you're a doctor for the elderly. So I was thinking, because I'm not really sold out of many food supplement, natural food. I usually prescribe drugs. Kasi gusto nila mabilisang gumaling eh. Okay? But, you know, since, sabi ko, I have to make a pilot study first before introducing to my patients. So I made it for myself alone. I had insomnia for many long years. We know as doctors, kulang tayo ng tulog palagi, lack of sleep. Laging lack of sleep palagi sa pag-aaral. So, na-develop up to now. But then, I took Mosigur Vita. That is iron. But I can sleep for that drugs. That's vitamins, but more than 150, more than that, because I already registered BFAD, yung mga vitamins, mga pagsobra na yung composition is drugs. So, I took drugs since young. So since I promised myself, before believing these products, I was just having my pilot study, taking it by myself. So yung oil, chamomile, it was given to me at the office from Miss Angie. When I visited her office, they gave me parang marami-rami yun, 4 na iba-ibang scents. So I tried yung massage lang through my forehead because sabi ko, I just make a pilot study. Wala namang mawawala. I just want to try it for myself before giving to my patients. So, hindi ako makatulog. Sakit pa, nagmamigraine ako, no? So, I just rub it. And after that following day, I had supposedly my lecture for that lecture sa Novaligis, Miss Eva, no? Wow. Hindi ako nakatulog ako ng gusto up to 11 o'clock. Eva was waiting for me at St. Luke's for many long hours since 6 a.m. in the morning up to 11. Nagising ako, nagising ako ng 11 o'clock ng morning. I supposed to lecture but all your products. So, good is good enough. Siguro the Lord wants me to experience the product before talking in front of many people. No? See, so, wow, this time, I can talk so much about them because this is my experience. Wow, pagdating ko doon, mga tao nakahanda na sila lahat, no? Sabi ko, grabe talaga itong Oleana topical oil. I congratulate sa lahat muna ngayon ang aking pasasalamatan ang Panginoon for giving the wisdom. Miss Angie, formulate these products. The wisdom is more than enough knowledge, right? So, the wisdom that the great God given to Angie is the best that she was able to formulate the best ever medicine, not medicine, natural food supplement for us. So I'm inspiring doctors, my co-doctors, to please try it first before prescribing to the patients. And right now, I'm starting prescribing to my elderly patients. And right now, I can hear many people from their own testimonials that one of them has a rheumatology, has a rheumatic problem sa kanyang tuhod, lahat na, ang dami niya mga osteoporosis, ang dami na mga kasi pag tumanda na tayo, ang dami nating mga sakit-sakit. Mag-umpisa na pag 40s, right? O sino nga yung elderly dito? Sino? Bata pa tayo lahat. And we look so pretty, younger looking. If you want to feel young, healthy, younger looking, start using Olea.
Miss Anna C. Montilla.
Hello, good morning. Grabe talaga si Lord. I would like to thank our God, our great God, for allowing me to stand before you this morning. Alam niyo po, napakasaya ko. I have so much joy kasi ito pala yung araw na God destined me to meet Ma'am Angie. Actually, in mid of March, I first came to know Olea. It was introduced to me by a friend who is also a nurse and was accompanied by Sed. Hi, Sed. Thank you. And then, when I came to know about the product, medyo, syempre, kasi I'm a nurse by profession and I had been in alternative medicine for 13 years now. I had been treating patients actually. Hindi ako doktor, but I take care of a lot of patients since 1997. And my first patient was my own father. And I found out that natural, organic, lahat ng mga supplements na to ay very useful kasi natural nga, walang side effects. So I started with my mission of treating patients in 1997. Sabi nga ni Doktora, ang kanyang talagang ano niya is ang mission niya, gusto niyang tumuklas ng supplement na natural na pwede niyang gamitin sa nanay niya. So ganun din po ako. I wanted really to know something na natural for my father. So nakita ko na mas maganda ang natural kaysa sa synthetic. And then when Olea was introduced to me, sabi ko, napakaganda ng product. Pero siyempre, binigyan ko pa ng doubt, 50% pa lang. Dahil iniisip ko, hindi ko pa alam kung ano ba ito, sino nag-formulate, kung paano ginawa, hindi ko pa alam ang component niya. And then I asked Sed to bring me to the office. The first time I went up to Olea office was in March 19. Maalala ko pa yon. And then nakita ko ang daming tao na rin. And then I was really curious. Alam niyo po, na-touch ako. Sabi ko, parang gusto kong ma-meet yung nag-formulate ng product. From then on, nung umalis ako sa office na yon, March 19, before bedtime sa gabi, nagdasal ako, Lord, thank you for Ma'am Angie. Kasi sinabi ni Sed, Tita Ana, ang nag-formulate niyan, biochemist, magaling siya. Graduate siya sa UST. So, mas lalo akong curious ngayon kasi cum laude, biro mo yon, ano, biochemist. Tapos, saan pa siya graduate sa UST pa. So, all the more, mas gusto ko siyang makilala. Sabi ko, desire ko yon, deepest desire ko talaga yon. I started praying for Ma'am Angie. God knows, totoo po ito, Ma'am Angie. Where's Ma'am Angie? Pinagpe-pray ko siya every night. When I wake up in the morning, Lord, thank you for Ma'am Angie. Hindi ko man siya kilala, pero I keep thanking God. Alam nyo ba, sabi nga ni Doktora kanina, wisdom po ito. When we speak about wisdom, it is a knowledge that came from the divine creator. Si God yun. Hindi basta-basta tao ang nagbigay ng knowledge niya. So, she is now being used as an instrument para makapagpagaling ng tao, para ma-address yung pain and suffering ng mga tao. With my 13 years in alternative medicine, grabe, ang pain ko dito is how can you alleviate, how can you help people alleviate their pains and sufferings. Kasi if a person is in pain, you are suffering. Totoo ho ba? Yes. So ano ang pinakagusto mong mangyari when you are in pain? Kung nag-experience ka ng sakit sa ulo, anong gusto mong mangyari agad? Ma-relieve ka ng pain. So how? Ang daming supplements, napakaraming supplements all over the world. Ang daming mga galing sa abroad, pumupunta dito, dumadating dito sa Philippines. Pero hanggang supplements is a supplement, hindi siya immediate. Parang imposible, pag sinabi mong immediate ang effect, natural. So, Olea is amazing. Amazing product. the fact na pwede, immediate siya. Napakaganda niya. So doon ako na-amaze. Kaya sabi ko, Lord, I keep thinking, Lord, thank you for Ma'am Angie. Hintayin ko yung time na ma-meet ko siya. Hindi ko lang alam ngayon pa na launching ng Olea. Doon ko siya ma-meet. This morning when I prayed, sabi ko, Lord, I surrender everything today. Take full control of my schedule. Kasi marami po akong pasyente actually. Pero tita, sabi ni Sed sa akin, baka pwede ka attend ka ng launching. Kaya nga ganito ang outfit ko ngayon kasi galing pa ako sa pasyente. Alright? So sabi ko, ano ba ito? Paano yan? And then when I met Ma'am Angie doon, pinakilala ako ni Sed. Hindi ko na talaga ini-expect. Tita, halika. Di ba gusto mo makilala si Ma'am Angie? Andito na siya. And then, siya nga pala, before si Ma'am Angie, yung husband niya, si Sir Mark. Sabi niya ganun, Tita, halika. Siya si Mark, Sir Mark, sabi niya, I don't even know kung sino si Sir Mark. Pero medyo kinabahan ako, sabi ko, baka siya yung husband ni Ma'am Angie. Pero inisip ko lang yon. Tapos siya yung husband ni Ma'am Angie, sabi ni Sed. So all the more, nag-leap yung heart ko. Imagine mo, yung husband ng taong gusto kong makilala, siya yung pinakilala sa akin. So tinawag ngayon ni Sir Mark si Ma'am Angie. Kasi sabi niya, Sir, gusto niya makilala si Ma'am Angie. Alam niyo po, tinawagan. Si Ma'am Angie, tuwang-tuwa ako. Grabe, napakasimple niyang tao. Alam niyo ba, nung pinili ni Lord ang kanyang mga apostles, hindi siya tumingin kung sino yung tao. Ganon si Lord. Kaya niyo, I believe, divine providence, ang nagtinakda talaga siya para gamitin siya ni Lord to be an instrument. Because this is an amazing product. It's not going to be in the Philippines only. Dinideclare ko ngayong gabi, it's going to be worldwide. Grabe. It's a product that we can be proud of. Pure Filipino product. At ang ating formulator hindi sa abroad. Isang Filipino. Grabe. Ma'am Angie, right now I would like to thank God again for you, for the wisdom, for gifting you this wisdom, for giving your talents, your treasures, and your time. Kasi alam mo itong tatlong T na ito yung napaka-importante. When you dedicate your talent para sa karamihan, para sa tao, God will bless it. When you dedicate your time for God and for people, God will bless it. And when you dedicate the small treasure that you have now, God will richly multiply it. Kaya sa inyong mga distributors ngayon na katulad ko na nandito na ngayon sa Olea, keep your hope kasi lalaki po ang Olea. International po ito. I want to thank God for all of you, for the family of Ma'am Angie. Isa lang po ang gusto kong hilingin sa inyo ngayon. Join me in praying for Ma'am Angie and her family. And not only for Ma'am Angie, for the company, for all of us who are with her. Thank you.
Dr. Cristobal Baloy.
Ako po si Doc Chris, tawag niyo na lang po. Presently po, sa PRC po ako, Professional Regulation Commission as a Medical Director and Consultant. Graduate po ako ng UST, Faculty of Medicine and Surgery. At nag-practice po ako sa family medicine practitioner and an occupational industrial medicine officer. Ang totoo po, bias po ako sa sa food supplement. Yan po ang katotohanan niyan. Pero magte-testimonial po ako na dahil po ako bias, dahil hindi naman po talaga tinuro sa medicine yan. I have here my colleagues, wala naman po kami subject niyan na nutritional medicine or konting-konti lang po. No? Pero para sabihin natin po na meron po mga patunay o testimonial na talaga pong meron po kami subjects niya, wala po. Kaya po bias ang karamihan po sa doktor. In fact, marami na pong food supplement ngayon at masaya po ako na hindi na lang po siya food supplement. Dahil po meron na silang studies, meron na rin po silang napatunayan na mga research, na-approve na po sila as therapeutic. At alam niyo po yun, yung aking mga colleagues po, ano po yun? Yung sa ubo, Plemex ang brand, Lagundi, di po ba? Food supplement po yan initially. No, but because of their studies, na-prove nila mahusay po sa ubo at saka po sa asthma. No, so, hindi na po siya food supplement lang. Ano pa po yung isa? Yung sa stone, sa uric acid. O yung diuretics, pwede po natin siya ibigay sa may mga sumasakit na balakang. Nakita po natin sa ihe, medyo a little blood, na meron pong amorphous urates. Ano po yun? Mataas ang uric acid, ang tinignan po natin sa blood chemistry. Sambong, very good. No? Food supplement po yan initially. Pero ano po siya ngayon? Therapeutic medicine. At ang maganda po, inapprove na po yan ng medisina, siyensya. Nandun na po siya sa PIMS o yung aming Biblia. No? So, accepted na po yan at galing po ako sa States. Actually, marami pong food supplement dun. Napakadami po. Ngayon, kailan po nawala yung bias ko dyan? Bago lang po. Ito lang pong taon na to, no? Because of the will of the Lord. Kasi dati, hindi ko pine-prescribe yan. Ngayon, araw-araw, pine-prescribe ko, masakit. Hindi kita bibigyan ng ibuprofen, hindi kita bibigyan ng mefenamic. Pahira mo ng Olea. Totoo po yan. Pero bago pa lang po ako rito, kung titingnan, pero tinatry ko, no? Kasi ang mga tao po talaga, ang mga doktor po, at ang mga siyensya, to see is to believe, kailangan makita natin, ma-prove po natin. At ito po, sa akin mismong testimonya, sa sarili ko, siguro gusto ni Lord na, sige, para mapaniwala kitang totoo to, ikaw mismo bibigyan kita ng kirot. Abay, binigyan nga ho ako. One time after my medical mission, kasi I formed my Love and Mercy Medical Mission, I'm a Christian Catholic, charismatic, under Lord's flock. Kaka-mission ko at kakalakad, no? Napagod. Sumakit po yung aking right lower quadrant. Saan po yan? Yung medyo malapit-lapit sa appendix. Naku, medyo masakit, no? Halabang pinepress ko, may tenderness, masakit. No? So, tinatry kong i-flex, medyo masakit. Kanya lang hindi ko maisip na appendicitis because wala akong fever. No? Pero, tinignan ko, baka pwede ring luslos kasi malapit sa inguinal area. No? Baka kakuluslos, may lahi kami. So, what I did, try ko, pinakapa ko, then inuubo ko kasi ganun po examinin ng kung may hernia. No? Ilalagay niyo po doon sa area na masakit, umubo kayo. Pag umubo po at may bumubukol, malamang po, yun po yung intestine. Kasi ang hernia po, ibig sabihin lang po yung muscles niya, nagwiwik, nagkaroon po siya ng opening, medyo nag-up and down po yung ating mga intestines. So, iinom sana ako ng gamot, ay naalala ko may uleya ako. No? So, parang may nag-ano sa akin, papahiran mo. Pinahiran ko yan. So, after yung pinahiran ko na po yan, nag-pray ako, definitely, lagi po dapat kasama. Yung pong i-assure ko sa inyo, kahit ano po pang produkto yan, dapat po may kasama pong dasal. At mas importante po yung kesa sa kung anong produkto. Pero ang katotohanan po, ang uleya po siguro, meron po talagang sinasabi nga natin, yung previous speaker po, no, narinig ko. And I'm happy, she's also a Christian, no, the way she talks. Lagi niya, no, she's giving praising and glory to the Lord. Totoo po yun, no, in alternative medicine, now ito tinatawag ko po ngayon na nutritional medicine. I read a book, binigay po sa akin. No, bago lang din po ako sa PRC, nag-start lang ako ng January. And there is one nurse here, no, yung akin pong nurse, may isa akong nurse, meron akong isang dentista. So, inaayos ko po yung medical system po, no, na health and wealth po ng mga ng mga empleyado at pati po yung mga pumupunta po nagre-renew ng lisensya. So, ang nakita po, ang title po ng book na yon, no, tatagalugin ko po para mas maintindihan natin. Ano daw po ang hindi alam ng mga doktor tungkol sa nutritional medicine na maaaring naging cause kung bakit may mga maraming namamatay. Mahaba po yung title. No? At doktor po siya. So, na-amaze ako doon sa book. At saka bakit niya ako binigyan? No? Siguro sa may sip-sip, ano? Bago kasi ako eh. So, anyway, yung nurse ko ngayon, ito pala, may experience na sa Olea. Tsaka sa mga ibang nutritional medicine. So what I did, I read. The author is a doctor. Bias din po siya sa food supplements or anything na may kinalaman po sa pagkain lang. In fact, karamihan po sa mga doctors way back, no, nananakot pa. Ay, pagka inano mo yan, may overdose niyan. Totoo po yan. Totoo po yan, no, napaka-bias nila. Pero kung titignan po natin, even the content of Olea, nakita ko ron, there is an olive oil. Am I right? May olive oil? Alam niyo po ba olive oil, biblical? Yes. So, doon pa lang po alam mo natin na may wisdom coming from above. Kasi kailangan po may knowledge tayo, wisdom. Lahat ng papasukin po natin, tatanungin natin si Lord. No, meron po bang permiso po to, Lord? Kasi po ito, totoo po, para po sa akin, tama po yung last speaker. Pilipino po ang nakadiscover nito, si Ma'am Angie. Na-meet ko lang po sila 2 weeks ago, barely 2 weeks ago, 3 weeks ago. Pumunta po ako sa office, pero meron na nga akong experience na naririnig, no, about Olea. Hanggang sa nabasa ko yung libro at na-try ko sa akin. Yung pinahid ko na po yung Olea sa akin, na akala ko po, niro-roll out ko, earn niya sa akin. Paggising ko, hindi ko na naalala may masakit. Wala na eh. So parang wala. Naalala ko na lang after 2 days. Teka muna, may masakit nga sa right lower quadrant ko ah. Wala na nga. Totoo po yun. Sarili kong pong testimonya. So doon ko po nakikita, may message po sa akin. At ito po, bago po ako pumunta rito, galing ako sa PRC. 2 of my patients, pinascribean ko po na Olea. At may study na rin po kami doon ngayon, yung aking nurse po, ang totoo, parang may gift po siya ng healing sa touch. Basta't po pain ang pumasok po sa klinika. Hindi po agad namin bibigyan. Yan po ang aking instruction ngayon. Pahiran muna natin. No? Hindi po kami agad nagbebenta, hindi naman po kailangan mo na ma-experience nila. Pagka nawala, hahanapin yan eh. So wag po tayo mag-focus dun sa benta. Mag-focus po tayo dun sa quality na ito po ay binigay po ni Lord. No? Ito pong sinasabing omega-3, omega-5, omega-9, may malunggay pa yan, cetylated oil. Hindi po tayo gagamit dito ng mga medical term, napakahirap po. Pero bakit po ba may kirot? At sino po ba hindi rito nasasaktan o kumikirot? Halos everyday po may pain tayo, headache, muscle pain. Tama po ba? Napaka-common po niyan. Pero there is one incident po na yung dati po na very common mo, yung methyl salicylate, ang totoo po niyan, in a very high dose at lagi niyo pong ginagamit, it can cause you trouble. It can decrease your lifespan. Kasi po, meron na pong incident yan, I read. Ewan ko kung naging familiar kayo dyan. 17-year-old, an athlete. Wala po siyang ginagawa kundi magpahid ng methyl salicylate na yan. Hindi ko lang po alam kung anong brand. So ano po nangyari? Na-poison po siya. Namatay po. It is happened in States. No? Naka-document po yan. So, sa ngayon po ba, ano alam po natin na binibili na over-the-counter na hindi po kailangan i-prescribe pero binibili po yan. Di ba puro lagi may methyl salicylate, may Campor. So ito po siguro, way na po ni Lord na alisin po natin yan. No, hanggat maaari palitan natin ng natural means, yung binigay po niya. At ito na nga po yun, Olea. So hanggang dito na lang po, hindi ko po pahabain. Siguro po sabay-sabay din po tayo. Tama po, lagi po na ang glory ay ibabalik po natin sa ating Panginoon na lumikha sa atin. At saka ito yung pinapapansin natin, bakit dito ginawa sa GCF? No? Bakit dito sa building na to yan? Most of the time po, no, hindi po sa ganitong lugar na ginagawa. No? Sa tingin ko po, palakpakan po natin ng Diyos kasi kasama po natin siya sa Olea. Magandang umaga po ulit.